Good morning. Today I want to talk about concussion recovery, when to listen to doctors and teachers and when not to, the importance of listening to your body and the healing process, but also the importance of not getting sucked into self-fulfilling prophecy of illness. So it's hard for me to title these talks when I get started. It usually comes through at the end, but just stick with me. If you're dealing with an injury and doctors or mental stuff, this is going to be valuable. I'm going to make it valuable. And then a quick note for those of you who are new to my talks. I talk fast, but then I take breath breaks, and encourage you to take the breath breaks. One of the biggest, and I repeat this a lot, but one of the biggest problems of our era is overstimulation. And do not underestimate the power of just a single deep breath to deal with the overstimulated environment that we live in. So number one, let's talk about overstimulation. Many of your problems can be traced back to overstimulation in today's world. Think about how we're designed, like the evolution of the human species. What kind of environments were we in 99% of our evolution? And if you consider our pre-human ancestors, it's 99.99999, to the factor of 14 or something of the environments that we were exposed to. The environments that we were exposed to were still, right? You look outside the window, there's not a lot of movement. There's the waves if you're on by the beach. So there's the ocean environment, which is in a constant sort of flow. And then there's the wind, and then there's the creatures. But those environments are not incredibly stimulating. They're stimulating in a different kind of way. I'm sure many of you heard of forest bathing, and it's basically being in nature. And now there's learning about, as they put scientific studies behind it, how the cognitive benefits, the physiological benefits of just seeing the soft edges of nature and being in nature. So we're highly overstimulated. And then you add our screens, which are these, a lot of times, incredibly high levels of movement. Super stimulating. So I have, on June 3rd, I got a concussion. I hit my head super hard on a rafter, and now today is, I don't know what the exact date is, but I think it's August 4th. Pretty sure it's August 4th. So I'm almost 2 months exactly out from that, and gone through, thought I was recovered, hardcore relapse, thought I was recovered again, another relapse, fear, anxiety, depression, all of that stuff. So I want to, if you're going through anything like that in your life, I want to help show you what I think has worked for me to get me to the other side. And I literally just pulled out yesterday. I mean, I was in it until pretty much this morning. So what is you're overstimulated? Most likely, almost everybody is. If you're watching screens, you're overstimulated. So we all need to practice boredom. I'm sure if you're in the social media world and the self-help world in terms of podcasts and stuff, you've heard that before. Like they've talked about, there was a movement to embrace boredom and the psychological and emotional benefits of boredom. One of the best things that I found with this concussion recovery is like really big inhales. And then, like as Huberman says, the physiological sigh. That one seems just intuitively to be one of the most important things to do. So back to overstimulation. We're overstimulated. And I was getting overstimulated in that beginning of that talk. And so now I'm going to slow down a little bit. I think the one that, can you accept that you're overstimulated? And here's kind of my proof. If you do a little thought experiment, try to sit with nothing in a familiar or dimly lit room and see how long you last. Doubt you're going to last very long because you're so addicted to constant stimulation. Longtime meditators, that's one of the extreme benefits of meditation, is that ability to sit in emptiness. Now we're always sitting in our thoughts, and so that's another level too. So you start with like a physical emptiness, like not moving and not opening your eyes, and then you move to like more of a mental emptiness where you're actually moving away from just, what I like to say is, stop giving your thoughts so much importance. Like just when you notice that your attention has got, I'm thinking, be like, okay, that thought doesn't matter right now. The most important thing I can do is just bring my attention back to my breath or my mantra or my body, whatever type of meditation that I'm doing. I have my preferences on meditation, but for this talk, that doesn't matter. So I think the first point of this talk is, please accept the fact that 99% of you are overstimulated. And if you're having trouble remembering things, or if you're getting distracted, or if you're having difficulty focusing, a lot of that is overstimulation. Now, some of it is just not being trained in how to focus, but most of it is just overstimulation. I gotta pay attention at the a little stronger here at the intersection. Okay, making our turn. All right. So nice. I just passed a lady, and she looks like she's in, I don't know, 65, maybe even more, on her bike, just getting her exercise. So cool. Going on a pretty long, hard ride, I think. So what to do about that overstimulation? I mean, the simple ones are, try to start a meditation practice. I get so annoyed when people say, I can't meditate. It's like, no, you can meditate, you're just unwilling. And what you're unwilling to do, and I totally get it. Like, I struggle hard with my meditation practice. And some days I'm totally unwilling to do it. But it's never that you can't. It's just that you won't confront, and here's what it is. It's that you won't confront the emptiness. You won't confront the monkey mind in your own head. You won't just sit with that, or even deeper, if you're doing a somatic meditation, which I like to do, which I think my personal opinion is they're the most powerful. If you do a somatic equanimity meditation, you face the uncomfortable sensations in your body, like pains or burns or aches or a nervousness or like a jitteriness in your bellies. All those things kind of come out, and you feel them more deeply. Most of the time what we're doing is masking the deeper uncomfortable sensations in our body with a video, a screen, a beer, whatever it is. The emotions that you hide from are physical sensations that you've got a narrative on that you're trying to avoid. All right, that's a whole other talk, like what is emotions. We can talk about that another time. So meditate, limit your screen time, walk in nature, stop just giving your attention to the thing that draws it the most. One of the biggest diseases of our culture today is the disease of sensationalism and the disease of outrage. It's like everybody's trying to get your attention so hard that you get all these crazy clickbait titles and and screenshots and stuff, and you're like, oh no, this guy, oh that happened, oh, and this guy's bad, and that guy's destroying the world, and all of that stuff is a disease. It's a cultural disease that we live inside of right now. So you got to buck that trend and start hanging out with people who are actively pursuing a different culture. So let's move on to community, because that's what's present. There's a few other things to talk about. Oh no, let's go to teachers. So with this concussion recovery that I'm in, I've been going to doctors, reading stuff, listening to podcasts. And so here's the thing. Everybody who's successful in their field is most likely going to have an oversized ego. So they're going to think that their shit don't stink because they've had a lot of success. And the problem is that they're probably maybe 60% right, maybe even 70% right, but they got about 30, 40% of it wrong. And they're not going to admit that. Most of them aren't going to admit that, unless you're like a Ray Dalio type and you practice radical open-mindedness and you've really crushed your ego and you've just been willing to see all the, your flaws as well as your strengths. That's a very, very rare individual in the world. They're definitely out there, but most people who are experts in their field are not that. They're very ego-driven, and that's fine. So, but you got to hold it in context. So you take that ego-driven and you take it in. So, for example, today I listened to this doctor who's the premier doctor in concussion therapy, and he gave me some nuggets. Like, it really took me to the next level. And I took those nuggets and I added them into my intuition and my experience, and they fit. And so for concussions, I know most of you listeners aren't going to have concussions, but it's specifically for concussions, and this applies to most therapies. Like, it was the same when I had knee rehab. It's the same with everything. So in concussion therapy, the conventional therapy is to tell you to just lay down and rest. And this guy, who's the most successful in the country pretty much, he's like, no. You got to get back out there. You got to get out in the world. And what you need to do is you need to modulate your inputs according to your symptoms. So you got to stay, for example, underneath a 3. You want to stay underneath a 3 with all of your symptoms, and make sure you don't get any of the really bad physiological ones like double vision or vomiting or passing out and stuff like that. But the conventional wisdom is to just stop doing everything. And what happens is that your brain starts to rewire. You become for example, an agoraphobic. Like, you don't want to go outside because you're bothered by the people and the stress and the lights, and so you train your brain to not have any stimulus. It's exactly the wrong thing you want to do. And so that was a really good thing that I heard. But at the same time, I could hear in his speech his overconfidence, and I could also hear where he would generalize everybody into the same camp. And in his case, he was trying to protect people from psychological rumination as one of the most negative factors, the anxiety associated with concussions, which I definitely had and have. But I knew that what he was talking about wasn't quite applicable to me. I was a little different than his normal case study person. And I know myself well enough, being on my path over the years, to know that it doesn't quite apply to me. And then also, he was very skeptical of the hyperbaric chamber therapy, which is actually something that I'm doing right now. But the reason that he gave wasn't founded in science. Like, a lot of times you'll find these guys who are, say that they're super founded in the rational scientific world, and then they'll throw out a reason which has nothing to do with the data. Like, his reason was that he didn't believe in the hyperbaric trips because he didn't want his people that were his patients to be chasing alternative therapies and stuck in a seeking loop in which something didn't work. So that was his reasoning, was that he didn't want them chasing things so they get stuck in this anxiety loop of sort of things not working. So perfectly valid from one standpoint, but not valid in my case. And if you look at the data, there's enough compelling data to show that the hyperbaric chambers actually do have a positive influence in the concussion recovery. And so here's the thing. So this is all going to circle back to how to deal with teachers, how to deal with doctors and teachers and mentors and authors, all those people that sound super confident. When they sound that confident, they have a lot of good stuff, but you got to learn how to filter it out. So in his case, his system is solid, but he left out the hyperbaric chamber because it doesn't quite fit into his particular methodology. But if he were to take his system and then add the hyperbaric into his system, it would still work, because his system was basically listen to your body, stay below a threshold of 3 in your symptoms, and then do all the things that we're talking about. And he was more focused on exercise, movement training, things like that. So the point is that when you're dealing with somebody who's telling you how to do something, like I am right now, you want to figure out, what have they really got? What are they really able to give to me right now? And where are they a little bit stuck in their ego and think they know more about it than they should, or they can't? It's not even a bad thing. It can be just a blind spot. Like, they just don't realize that their mind is shut down to them. We all have blind spots. The famous saying, we don't know what we don't know. He doesn't know what he doesn't know, and that's fine. And so what I find is that people go two ways most often. Either 100%, I'm going to do everything this guy says, or 0%, he's a quack, I'm not going to listen to him. So you do have to figure out who's trustworthy. And so I think this guy is trustworthy, but I also think his scope was narrow. So he wasn't really into supplements. He wasn't really into that stuff. He had a narrow scope of what his therapeutic approach was going to be. So, so that example I give just as this is going to be, if you're dealing with something that you need to heal from, I really think this is the best way to do it. You want to listen to the advice of the people that are the most successful in their field, but then also try to see where you'll hear it, and you have to train your ear. You'll hear it in a subtle way that, like, oh, they went from talking about the data-driven stuff to they just shifted to a totally personal or preference or an analogy. And it's hard to see because these people who are so strong in their ego, they do it so fast that you don't notice it. So you have to really train yourself to notice it. I should do a whole other talk about how to peel apart all the weird things that people with big egos do with their words and their ideologies. I'll put on my glasses because I'm feeling a little bit. My eyes are feeling a little bit strained, so I'm trying to keep my symptoms under a 3. So that'll bring us to the next point, which is good pain versus bad pain. So anytime you're trying to heal yourself, you want to run into the good pain and run away from the bad pain. So how do you define a good pain, a bad pain? So when it came to my knee injury, a bad pain was like anything that was acute in the joint after I had fully recovered. So when I had my ACL replaced with a cadaver ACL, they put me immediately on the bike, and that was painful. But that was so that the muscle didn't atrophy, right? So it's not so cut and dry. It's really kind of difficult to get the good pain, bad pain, but you at least got to be on the hunt for what the good pain, bad pain, what they are. So you can follow some general rules when you're talking about good pain, bad pain. So a bad pain is generally going to be sharp. It's generally going to be in the exact same place every time. It's generally going to be recurring over and over again. And a good pain is generally dull, and it generally sort of diffuses away from the central point that, oh shoot, I'm in the wrong place. I went to the bank before the title company. All right, off to the title company. So good pain, bad pain. So when I used to be a therapeutic, full-time therapeutic yoga instructor, that was what I was constantly working with people, because, yoga, like anything, people damage themselves all the time, especially the Ashtanga people who are all like stuck up in their egos and think that, they know the right way. And then they twist their body into all kinds of pretzels and give themselves all kinds of injuries and tears because they're not listening to their body. They're not listening to the subtle differences between the good pain and the bad pain. So a good pain, for example, a good pain, when I get up in the morning, a lot of times, first thing I'll do is just lean against my counter and stretch my calf. My left calf is always tighter than my right calf because of an old inguinal hernia that I inherited. I had it since I was 7 years old. And so that hurts, right? But it's a good pain. I shouldn't avoid it. If I avoid it, then my calf is going to atrophy and then have all these other effects up my system where it's not going to function properly. So like a stretch. But then again, if you go too far, then you can tear. You can tear too much. I mean, the stretch is actually making micro tears. So it's this. The truth is always in this balance between, for lack of a better term, the yin and the yang. The pushing through the pain, the listening and yielding when it's too much pain. I wish I could give you a simpler answer, but the answer is awareness. The answer is mindfulness. The answer is paying attention to what your body is saying to you. But also, it's kind of like you want to have a father, a father figure or a dominant figure on one side, and then a mother figure or a passive nurturing figure, like two angels, not in the Christian way, but in a father-mother way. You want them both to have an influence on you. You want each side to be saying, one side to be saying, you need to push yourself, and the other side saying, like, you need to listen and slow down. So you don't ever get this, like, it's never one or the other. That's when people really get jacked up. You get like this hyper like passivity, and then you're just a ball of jello, or this hyper aggressiveness and you're an asshole, and you're inconsiderate and not compassionate, which is one of the things that's going viral these days, is being an inconsiderate asshole. But the point is that neither one's right. You have to find the middle path. You have to surf between the two sides. So with this, what I did with my concussion was I went all yin. I went all like, and that's what the conventional therapy is. They just lay in a dark room. You got to lay in a dark room for 6 months. And I was freaking out because I do not have the financial resources to sit in a dark room for 6 months. If you're anything like me, like, I got bills that come every month and they don't stop if I stop working. And I don't have a safety net. I live in America, so yeah, no safety net America. Anyways, so I can't help but be a little political sometimes. Try not to, but it gets in there. Let's see. I'm a little distracted. Let's wrap this thing up. Good pain, bad pain. Overconfident teachers, watch for the ego. Overstimulated, slow down. Father, mother, yin and yang. Find that balance between the aggressive pushing and the relaxing, releasing. There's no simple answer. So that I've surfed my whole life, and I really do think that it's the way. And I'm sorry if I'm biased, but you have to ride it. You have to find that place that's in between the opposites. And that's where vitality and health and happiness and joy and creativity and all that stuff happens. It's in this balanced state. People think of a balanced state as like being dead. It's like, I think it's absolutely the opposite. I'm just coming to really learn this in my tender 56 years, that, it's through this dance between the aggressive and the passive and the pushing yourself and relaxing, that we find this maximum vitality. I hope that's helpful. It's really feels like masterwork for me, that I really feel like I'm on this healing path. I wish you best of luck on your healing path. Please leave me comments and questions, and have a wonderful day, and I hope to connect with you again soon.